On Sunday, President-elect Donald Trump was grilled about his concepts of a plan for healthcare.
Sir, you said during the campaign you had concepts of a plan. Do you have an actual plan at this point for health care?
Yes, we have concepts of a plan that would be better.
Still just concepts? Do you have a fully developed plan?
Let me explain. We have the biggest healthcare companies looking at it. We have doctors. We're always looking because Obamacare stinks. It's lousy. There are better answers. If we come up with a better answer, I would present that answer to Democrats and to everybody else, and I do something about it. But until we have that, or until they can approve it,
I have concepts of a plan. And look, hey, if we come up with a better answer, I mean, I will present that answer. What, you only had 8 years, if not longer, okay, to try and come up with a plan. But yeah, okay, so assuming he could come up with a better plan from his concepts, or just a plan in general, would it actually be better? Well, the answer is no. Why? Because he just said that he has the biggest healthcare companies looking at it, and they're pretty invested, literally, in making sure that we actually don't have better healthcare. Okay, remember, these are the same companies that are massively profitable because they deny people healthcare. You can see the claim rate denials by insurance companies, okay, and United Healthcare being at the bottom with a massive, nearly a third of all claims being denied. Then there's Medica at 27, Anthem 23, CareSource 20, Aetna 20%, Cigna 18. The industry average is 16% of all claims are denied, okay? But United Health, of course, takes the cake out of all of them. And the reason that they do that, of course, is that they make money. And that's why they're one of the, wealthiest, most profitable health insurance companies by denying you care and then tying you up on the phone, to talk to basically beg them. We've been giving you all of this money for so many years. Now when I actually need you to cover something, you're saying, no, I don't think so. What? Gee, I wonder if that and the 500,000 Americans estimated that go into bankruptcy as a result of medical bills are going to be excited to know that Donald Trump's concepts of a plan will involve these same people who are currently screwing them and trying to figure out a supposedly better plan. Now, obviously, the reality is Donald Trump doesn't have a plan. He never had a plan. Okay, unless you count the failed attempt to take away the ACA, of which he is now, by the way, he's now taking credit for protecting the ACA.
I am the one that saved Obamacare, I will say, and I did the right thing. I could have done the more political thing and killed it, and all I had to do is starve it to death.
You did try to have your Justice Department effectively kill it, though,
No,
sir.
Kill it from a legal standpoint, but from a physical standpoint, I made it work.
Oh, I could have killed it, but I made it work. But, from a physical standpoint or something. What? Okay, here's the thing, though. Donald Trump knows how to read polls. It's one of the few things he actually is able to read and understand, okay? And he knows that the ACA polls really well. 54% of U.S. adults approve of the Affordable Care Act, according to a poll by Gallup. Not sure how Obamacare polls, though. I mean, I know it's the same thing. Trump apparently knows that it's the same thing. That's why he said, I saved Obamacare. But you would be shocked by how many people, especially Republicans, don't. These are the ones that are like, I hate Obamacare, but I love the ACA. I remember talking about Kentucky voters that were like, I love Connect. I love my, healthcare exchanges. I actually was able to get insurance through them. Oh, it's great. Yeah, I love that. And then they're asked, okay, what about Obamacare? Do you like Obamacare? Oh, I hate it. Hate it. Worst thing ever. We got to get rid of that. Same thing. They had no idea. Okay, no idea. Now, here's the thing, though. the ACA, while it actually is fairly popular, 54% of adults, okay, say it's okay, good, yeah, I like it. The problem with it is that it's a private system, okay? That's what it is. And what it requires is the public money to subsidize it. That's how people are able to, get tax credits to be able to afford their insurance. Okay. So when people buy insurance through their state-run marketplaces, they qualify for tax credits, or can, that effectively discount the premiums by hundreds, if not thousands of dollars annually. So, big savings, right? So now that's the government subsidy, which goes right to the health insurance companies, the executives, the shareholders. Okay. So it's corporate welfare, straight up. And it's a waste. And a lot of it goes to this administrative bloat that these for-profit private companies have. And that's one reason why health insurance continues to be more and more and more expensive. Medicare has a far lower administrative cost than private insurance because it's not for profit. That's how it could save people money. Okay. That's how it can save the government money. Current Medicare has far lower administrative costs than for-profit insurance. Okay. Now, the problem that Donald Trump is going to run into, he's going to run into many problems, I believe, over the next 4 years. But one of them is health insurance costs are going to skyrocket. This is pretty much a guarantee. Why? During COVID, President Joe Biden actually boosted the subsidies, okay, to help people deal with COVID, to try to get them, incentivize people to buy in to more health insurance. So the subsidies are a little bit more generous. And so you ended up seeing more people record enrollment in the marketplaces. That's going to run out. That means once that premium support runs out, health insurance premiums are going to go way up under Donald Trump. According to the CBO, allowing the extra subsidies to lapse would cause premiums to rise by 4% in 2026 and by close to 8% in each of the years afterwards. So that's a couple of years into Trump's presidency, which means he is not going to be able to blame Joe Biden for this one. Okay? So that increase, by the way, is not insignificant. It would work out to about an extra $700 a year per person in out-of-pocket costs for those buying coverage through the marketplaces. Now, that, of course, is unless Republicans approve of these more generous subsidies, which they are, I think, unlikely to do. Okay, and why is that? Because they're all about, oh, we gotta cut the waste. We gotta, basically, they're gonna cut anything that helps average people. Let's be honest, and then give themselves a massive tax cut to balance it out. Oh, we're cutting waste, but that's okay. We're also cutting taxes for ourselves, rich people. So it'll work out. Trust me. No, it won't. And now, in fact, the net 10-year cost of increasing the subsidies would be more than $300 billion, according to an earlier CBO estimate, which means Republicans, they're not going to be interested in doing that. Oh, hell no. So that means the voters are going to be pissed at Republicans. For once, it's not going to be at the Democrats, because there won't be a way to really blame Joe Biden for this. So congratulations, Republicans. You're about to head into a midterm disaster as a result of probably allowing these subsidies to not end completely, but to be reduced, which is going to be a massive increase in costs for the average consumer. So, you better hope that those concepts of a plan that Trump has is going to be able to come in and save you guys. Because if they're not good concepts, then you guys are toast politically. 6 days into the manhunt that started with the slaying of a health insurance CEO, police officers in Pennsylvania have detained a man for questioning. 26-year-old Luigi Mangione was picked up at a McDonald's in Altoona after an employee thought that he looked like the man in the NYPD's photos and called the police, according to sources. He was found to have possessed fake IDs, including one that the NYPD believes was used by the killing suspect in New York, as well as a silenced weapon. The man also apparently had some documents investigators wanted to examine, potentially relating to a motive, like a manifesto, apparently. So, hey, big development, right? Now, there's been a lot of developments over the last 6 days, like finding partial fingerprints, DNA. However, there were no matches in the law enforcement databases, which means that Mangione, if he indeed is the killer, had no prior offenses. They also found his backpack that contained Monopoly money. So, I mean, look, they've got a lot of stuff, okay, a lot of evidence against him so far. I'm not going to say 100% that it's him, but, I mean, there's a good chance it might be him, all right? Now, that said, it's a little strange to me. He had 6 days. 6 days to flee, and he was only in Pennsylvania, waiting at a McDonald's with the gun and the fake IDs. I don't know, man. For me, if it indeed is him, then it really does seem like he wanted to get caught. That's just my read of the situation. Okay? And by the way, if you're trying to send a message, then, well, getting caught and having a trial would be the way to do it. Okay? Oh, but why did he run then if he wanted to get caught? Because it plays up the suspense. All right? But again, that's just my opinion of the matter. Okay? I don't know for sure. Okay? So take what I'm saying with a grain of salt. Okay? Now, that said, before he was caught, law enforcement experts did talk to the Daily Beast. This was on Sunday, and said, look, that the evidence overwhelmingly pointed to a profile of a suspect as a both competent and supremely motivated killer who intended to convey a larger message. In fact, retired FBI agent Jennifer Koffendorfer said, quote, to me, this seems like somebody far beyond just a personal situation, that he lost a family member or loved one due to a lack of being insured. Seems much larger. Like a vigilante, someone who is well prepared to make a big statement, and that he blames United Healthcare in this situation. Well, I mean, you would be one of many. After all, United Healthcare denies like about a third of all claims. Okay. Now, forensic psychiatrist and expert witness Dr. Carol Lieberman adds this, quote, the monopoly money conveys messages both that United Healthcare is a ripoff, true, that steals money from patients in order to pay its executives millions, that itself is a monopoly. She said he may have planned to scatter the monopoly money around the CEO's body after he shot him, but forgot to take the bills out of his backpack. Like, maybe they're right. Okay. I mean, yeah, definitely. Okay, in my opinion, yeah, definitely a message, right? Now, that would, of course, explain why there's the reaction is the way that it is. Okay, why you had so many regular people that didn't really have sympathy for his victim. It's not that they're excusing murder, but they're like, I don't know, my sympathy is out of network. And, got denied. What are you gonna do? And then, of course, others were like, oh, I don't really mind if he gets away. I've seen those comments. In fact, there are some people that turn him into a bit of a folk hero, giving him the moniker, quote, the adjuster. So, yeah. The adjuster, who struck a blow against America's predatory for-profit healthcare system. I don't know, again, if this is the case. I don't know what his goal was. Okay, don't know. But a lot of people have made a lot of, I don't know. Maybe there's a lot of projection here from a lot of people who've been burned by the healthcare system that are projecting like their anger onto him and saying that he is fueled by that same anger. We're going to have to see whether or not Mangione is the guy and whether or not he actually is the folk hero that people are painting him as. And it should be interesting. Now, that said, before he was caught, there were people that suggested flooding the police with fake tips, dressing like the killers, or the killer to confuse the law enforcement officers. In fact, it had a lookalike contest on Saturday. Others who had previously helped police identify people decided to sit it out, which apparently, if this happens to be the guy, then I guess, that didn't really have too much of an effect. One says, quote, "I don't have to encourage violence. I don't have to condone violence by any means, but I also don't have to help," wrote that Danish guy who has 2 million followers on TikTok and who generally says, "I can find anybody." All right. Now, one poster on Reddit writes, "I kind of hope that they never catch him." Why? Because he rightly points out the rich almost never get their due, and added, "Hell, I'll go as far as to say is maybe people should go and flood the cops, and now the FBI's hotlines with fake info, troll pics, and the like." So, again, if it is Mangione, then, they didn't do that. Okay. And by the way, I don't encourage that. I don't discourage that, but I don't encourage that either. I'm just saying. Now, this attitude, of course, had some people very, very upset. Okay. Ed Davis, former Boston police commissioner, told the Wall Street Journal over the weekend, quote, "I've been watching it and I've been shocked by it. It's actually troubling to see it. And I'm really surprised that people are reacting that way, considering the tragic loss here and the violence of what happened." Okay, I got to ask, tragic loss? Well, for whom, really? Well, his family? Of course. Yeah, absolutely a tragic loss for them. For United Healthcare, not so much. In fact, the day that it happened, they actually continued their shareholder meeting. I'm not kidding. Over the weekend, by the way, I got texts wanting me to sign up for their health insurance. Are you kidding me? Really? If anything, this kind of illustrates how useless CEOs really are. Yes, I said that. Useless CEOs, okay? The fact that the company had still been operating with no problems whatsoever and still pulling in profit kind of tells you what you need to know, okay? Not only that, but on the day that Thompson was gunned down, their stocks went up. But the only time their stock price went down was on Sunday after this video of United Health CEO Andrew Whitty, who was Thompson's boss, was leaked.
And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
So that was him talking to other executives, I believe, were shareholders. Okay. And so, like, oh, yeah, we're so important here. What we do, we guard against the pressures for unnecessary care. Again, this is the company that used a faulty AI program that denied 90% of claims for people on Medicare Advantage plans. These are people who are seniors, okay? Elderly people, all right? On the privatized Medicare plans, which people are finding out, oh, they're kind of scammy. Yeah, and it actually makes it hard, if not impossible, to enroll back into traditional Medicare when they find out that, oh, it turns out these Medicare Advantage plans are junk. Yeah. But I love the whole thing about, the system, we guard against the system being more complicated and unsustainable. No, if anything, you guys are the reason that the system is complicated and unsustainable. It's the insurance companies that make it complicated and unsustainable. It's also important to note that this guy, Andrew Whitty, is currently facing a Department of Justice probe into insider trading allegations. Gee. Oh, that's interesting. Oh, you know who also was facing some insider trading allegations? Yeah, Brian Thompson. Yeah. Now, unlike Brian Thompson, Andrew Whitty actually makes more. His last fully calculated compensation package in 2023 is a total of $25 million. Brian Thompson brought home $10 million. Now, once again, this is why people of all different political stripes have had no sympathy towards these guys whatsoever. In fact, last week, the Daily Wire's Ben Shapiro put out a video titled, "The Evil Revolutionary Left Cheers Murder." The replies, of course, were not what Shapiro expected. It's not just the left, Ben. Sorry, Ben. It's not just the left. We got conservatives and liberals hugging each other in a comment section before GTA 6. Saw my lifelong hardworking father become bankrupt as a result of claims being denied and getting cancer. You're out of touch, man. It's not left or right. It's not black or white. It's rich versus poor. Your true colors are showing. Ben always forgets that his beloved Israel has universal health care subsidized by U.S. taxpayers. Yet he is always saying how it wouldn't work in America. Interesting. This comment section is humanity making sense for the first time in years. Sorry, I cried all my tears when my mom had to put her PET scan on a credit card after her leukemia diagnosis. She and my dad were making payments monthly. A year later, she's still paying, and my dad dies of a heart attack. Hospital harassed my mom to pay his $10,000 bill until she had to file bankruptcy. She now lives in a community for low-income seniors and gets her food through church food bank donations, which is mostly processed food. I don't have many tears left for a perpetuator of the system. And finally, I'm not buying this left versus right shit anymore, Ben. I want healthcare for my family. More comments here, a couple more. Wow, maybe I've been wrong this entire time. Ben, I don't think you actually care about us. I think you just want our money. I think you want us to hate each other. Uh-oh. Another comment. Your business model requires us normal people to hate each other. Oh no. I think he's in trouble.
Oh no.
Oh no. Look, as far as dislikes on the video go, Ben Shapiro, and I know YouTube hides dislikes, but I have there's a browser extension that allows you to view dislikes. This is at 6.7 thousand likes with 45,000 dislikes. Ouch. So yeah, I mean, there you have it. Okay. So look, if Luigi is actually the guy, I'm starting to think that it's because he wanted to get caught. Okay. I think maybe he wanted to go to trial. Look at all the attention. Look at all the rage against the industry. If you're really trying to send a message, well then, I mean, that's the way to do it. Okay. Look at all the fear from the health insurance CEOs. And the fact that you actually are starting to have some class consciousness emerging online. It's going to be very, very interesting to see what happens going forward with all of this, especially now since it looks like very good chance that this is the guy and that there is going to be a very public trial. Following last week's shocking murder of a healthcare CEO, I think it'd be a good time to dive into why Americans, now a majority, believe the government should be guaranteeing every American healthcare coverage. In fact, there's a new Gallup survey finding that 62% of Americans say that it's the federal government's responsibility to ensure that everyone has healthcare. Now, 62%, that's actually higher than it's been in more than a decade. In fact, large majorities of Democrats have consistently believed that the government should ensure that Americans have healthcare coverage, but in recent years, they've been joined by independents and even Republicans. Still not a majority of Republicans, but a lot more than you think. In fact, currently 32% of Republicans now hold the view that government should provide healthcare coverage. That is up from 22% in 2020. Among independents, it's a clear majority, 65%. That's up 6 points from 2020. Wow. Not only that, but public support for the Affordable Care Act is now up to 54%. Okay, so it's not a surprise that public support for universal health care is now shared by the majority of Americans. Okay, so, but Jeff, okay, but what about the poll saying that most people are currently satisfied with their insurance company? Well, here's the thing. Yes, sure they are until they actually go to use it. See, that's one of the problems, right? So if you haven't had to use your insurance, then you're going to be like, yeah, of course I'm satisfied with it. Yeah, I pay my premium, because generally if you can, pay the premium, then most of the time you'll be able to afford that premium. Or a lot of times you get your insurance through work, right? And that's the other thing, right? So you get your insurance through work, your employer actually covers a portion of that premium, and then you pay the rest. So it's actually not too expensive. Okay. But again, the problem arises when you actually go to use that insurance. So when that happens, well, you start not being so happy with it. Okay. In fact, when you actually do have to use it, it turns out they're like, oh yeah, no, that's actually kind of poor. And of course, the reason is that they run into denial of claims. They run into massive amounts of paperwork. You have to spend hours on the phone to get approval for procedures and treatments, and you're basically trying to fight for your life. Okay, and look, if you don't get those treatments, if you don't get that medication in time, then well, you end up dying, and then your family will get flipped off by people who work at the health insurance companies. And in fact, there's an example of this. Back in 2010, HuffPost reported on a story about Hilda and Krikor Sarkeesian and their 17-year-old daughter, Natalie, who was denied a liver transplant by their health insurance company, Cigna, and ended up dying as a result. Okay, so she didn't get approved for that liver transplant in time and ended up dying. Now, the parents, understandably, very upset. They went and protested outside of Cigna, their headquarters in Philadelphia, to try to speak to the CEO at the time to demand an apology for allowing their daughter to die because they wouldn't approve her transplant. So now she went there. She didn't meet the CEO. She ended up, they ended up getting met by security as employees heckled them from a balcony. One man even gave them the finger as police escorted them from the building. Remember, this is a family who faced massive tragedy, lost their daughter as a result of the executives pinching pennies, okay, and not covering this very necessary to save someone's life surgery. Oh, too experimental. Yes, that's it. They reversed course after some protests, but again, it was too late. She was denied, and she ended up dying. These are the death panels. Remember when Republicans talked about death panels when it came to universal health care? Okay. Oh, see, you're gonna put the American people are gonna have to face the death panels, you see, and they're gonna make the decisions whether you live or die. We currently have death panels right now. The companies are the death panels. We have them. It just so happens that these death panels encourage denials of care, okay, because they save money. They make money when they deny you care. They take your premiums for years, and then when you need it, they deny you the care because it's profit. And understand that that's what happens when you privatize public goods, like healthcare. Okay, so those of us in America, we know this because we have lived this. But people in other countries, I know I get a lot of international viewers, and y'all are like, "What are you doing over there in America? This is crazy." Well, yeah, but it's important to talk about it because guess what? Other countries, you have politicians in Canada and the UK that are trying to privatize your systems to Americanize them. This is why it's not a good idea. Okay, so this is why privatization is bad, and I'm going to show you more examples of that. By the way, earlier this year, a study led by the University of Oxford, this is researchers there, and this was published in The Lancet, they found that privatized hospitals actually led to worse care. Once again, big shocker, right? Oh my God. Do you realize that when you privatize hospitals, you end up actually costing people more and having worse care? Yeah, no kidding. Key findings in that report found that increased privatization generally corresponded with worse quality of care, with no studies included in the review finding unequivocally positive effects on health outcomes. So worse outcomes. Great. Hospitals converting from public to private ownership tended to make higher profit, but was mainly achieved by reducing staff level and reducing the proportion of patients with limited health insurance coverage. So they end up dying or getting offloaded onto the public system. Great. Privatization also generally corresponded with fewer cleaning staff employed per patient, which meant higher rates of patient infection. And in some studies, higher levels of hospital privatization corresponded with higher rates of avoidable death. Yeah. So, big shocker, right? According to the researchers, the results challenge the theory that privatization can improve the quality of healthcare through increased market competition and by enabling a more flexible patient-centered approach. Now, that's hospitals, right? Insurance, of course, I think is worse because what insurance companies are just literally a middleman that extracts profit and might actually kill your family, by denying them necessary health care. And that's if you're lucky enough to even afford the insurance in the first place. If you don't have insurance, then it's even worse. Okay. In fact, one person on Facebook wrote of one of the leading insurers. This is United Health Group. Quote, the company put multiple of my family members in debt that they will be paying for the rest of their lives and denied care for my uncle, which led to his death. Yeah. And if they don't die, they go bankrupt. In fact, over 1,000 people go bankrupt daily because of medical bills. So this is real. And this is a result of our privatized healthcare system. No other country, okay, has medical bankruptcy like we do, okay? And I know the rebuttal to this might be, but you don't understand, people in other countries with socialized medicine, well, they have to wait. The wait times are so terrible. You know what? The wait times are pretty terrible here too, okay? I know plenty of people with insurance who have had to wait months for a specialist appointment. Yeah. And not just that, but weeks for an appointment just with their provider. And I'm betting most of you are aware of this as well and know someone who's had to wait or have had to wait yourselves. Now, there's no official tracker to how long people have to wait. Nothing official anyway. But there is an Axios Ipsos survey last month that found that nearly 1 in 5 respondents said they had to wait more than 2 months to see a primary care physician or specialist, with waits trending longest in the Midwest. So here in this country where we have private healthcare, which is supposed to be like, it's supposed to reduce inefficiency and actually be more efficient and then low wait times. No, we don't have low wait times. We have incredibly long wait times. In fact, ECG management consultants had actually looked into this as well. They used secret shoppers, right, to measure average wait times for new patient appointments in 11 medical specialties in 23 metro areas. They found that the average wait time for the third next available appointment was 38 days. Wait. What do you mean third next available appointment? What does that mean? Well, basically, it's a common metric for patient access that reduces the effect of late cancellations and other anomalies. Because sometimes, you got to cancel appointments. Sometimes you can't make it. That does happen, right? But, they factored that in and still found that, 38 days. 38 days. It's over a month. AMN Healthcare's 2022 survey of physician appointment wait times and Medicare and Medicaid service acceptance rates showed that the average wait time for new patient non-emergent appointments across 5 specialties was actually 26 days. That was in 2022. That was up 8% from the last time the survey was conducted in 2017, and up 24% from when the survey was first done in 2004. So now, of course, some people are saying, well, that's because you have more people that are needing services. So, and I'll point out too that, yeah, there is a provider problem. There's not enough providers, not enough doctors. I get that. Maybe that's got something to do with our privatized, I don't know, college system, where it's really, really expensive to be able to get a degree and become a doctor. It takes a lot of money, a lot of years trying to become a doctor. And so not a lot of people are taking that expense. And you wonder why. And so that's having impacts all across, all the way down the health field to, oh, now we have really high wait times. So that's another reason why privatization is a terrible idea. So, look, when it comes down to it, we pay more than any other country on the planet for healthcare, okay? And we still have massively long wait times. And at the end of the day, we actually have worse outcomes. That chart shows life expectancy versus how much we're paying for this, okay? Versus all these other countries. And you can see the United States, most expensive, worst outcomes. This is the result of our privatized healthcare system, which is nothing more really than wealth care for these CEOs and executives. Okay, so what's the solution? I think it's pretty obvious. Medicare for all. Expand traditional Medicare. Not only just give it to everybody, okay, regardless of your income, who you are, whatever. Truly universal system, right? Not just expanding it to everybody, but also to expand what it covers. Okay, you know, make it comprehensive. Include vision, include dental. Turns out teeth are not just luxury bones, and you do need eyes. Okay, so you need to see. Those things are very important. You need to hear, hearing as well. Okay, expand all that. We know what the problem is: privatized healthcare. Okay, profit motives, and we know what the solution is: Medicare for all. It's very, very simple. But unfortunately, even though there's a simple answer to this, getting that simple answer enacted is a lot more complicated. Okay, and the reason that for that is politicians that get paid off by health insurance companies. Okay, United Health Group since 1998 lobbied over $100 million, meaning they went to our politicians and they gave them $100 million. Okay, to do what? To vote against universal health care, to vote against a public option, you know, to vote against Medicare for all. Okay, that's it. And those politicians also, in taking that money, have decided, oh, we're going to try to figure out a way to sell you a reason why we have to not only prevent you from getting health care, okay, a government option or even a public option while keeping private insurance, okay? Not only are we selling you that, but we're also going to sell you a reason why we're going to have to cut Medicare. That's the reality of the system. It is absolutely corrupt. And that's what privatization leads to. Worse outcomes, okay, more expensive for the average person, and legalized corruption. A Republican representative has suggested some cuts for Elon Musk's Department of Government Efficiency. And you're not going to be surprised who they've targeted.
We all agree that this is an unsustainable area that we're in right now, almost $36 trillion in debt, and we are spending more on the interest on our debt than we're going to spend on the National Defense Authorization Act this year, over $1 trillion. And so we've got to right the ship, and it's going to mean cuts. It's going to mean cuts to the 24% of the discretionary spending that we have. And it's also going to mean looking long term at the front end of some programs like Social Security and Medicare, not taking anyone off of what they paid into so far. But there is some waste, abuse, and fraud in Medicare that we can take those numbers back and add to our general coffers and our Treasury. And on the front end of Social Security, I think there's a way when people are living longer, they're retiring later, that on the front end, we can move that retirement age back a little bit.
So that was Republican Representative Mark Alford, who is straight up lying to you. Why do I say that? Oh, well, he talked about, the front end, we can do some Social Security cuts. Why? Social Security doesn't add a penny to the national debt or the deficit. Why are these being included? Why do you preface this with, well, we're $36 trillion in debt, and really we could save some money by cutting Social Security? No, because there is no, it doesn't add a penny to the debt or the deficit. Social Security pays for itself through payroll taxes. Now, it's fully paid for, okay? Now, the only reason why these people are bringing in Social Security is, remember, and talking about, oh, we're going to have to do the retirement. We're going to raise the retirement age. We have to. The only reason they're talking about it is so that they can give corporations a tax cut. Because corporations also pay the payroll tax. That's how Social Security is funded, through payroll taxes. And again, your employer pays part of that. You raise the retirement age, and then suddenly, all these corporations, and rich people, by the way, who also pay the payroll tax, they get a tax cut. That's the plan. Now, when it comes to Medicare, things are a little bit different, okay? Now, here's the thing. Medicare is more efficient than private insurance, okay? One of the problems with Medicare and why it's the cost is so high is, you're not going to be surprised. There's a lot of Medicare plans that are privatized. It's actually half privatized, okay? In the Medicare Advantage, right? Medicare Advantage plans are just private insurance. That's it. Okay, they're privately administered. Now, analysis found that Medicare Advantage plans actually cost the government and taxpayers more than traditional Medicare on a per beneficiary basis. Now, you might be like, what? Yeah, but, Medicare Advantage offers things like vision and dental, and maybe that's why it costs more. Wrong. Yes, they do have these additional perks, right? Which, again, if you actually expanded traditional Medicare to cover those things, and it's been blocked from doing so, understand, through the efforts of lobbyists, lobbying our politicians to not expand Medicare to cover these things. Traditional Medicare has a lower administrative cost. That's why it's cheaper. Okay. Now, one of the ways that Medicare Advantage actually has higher costs is upcoding. What's upcoding? Basically, what they do is they systematically assess enrollees as having more health conditions and to being sicker on average than is actually the case, right? That inappropriately raises total payments to plans, i.e. government, public money going into private hands. More of it because they're basically flat out, in some cases, lying about how sick the person on the Medicare Advantage plan actually is. The result, of course, being the company pockets the money. It's that, hey, would you look at that? I found the waste and the fraud. It turns out that's all a result of the profit motive from these private companies. Once again, we have found that privatization bad. Okay, it actually costs more without any noticeable increase in patient outcomes. It just costs more, and it makes a couple people that much richer. Shocker. Now, I'm not saying privatization is all bad, right? There are some things that should be private. Do I want the government making shoes? No. No. Now, do I want Nike making shoes? Well, that would depend on whether or not they're using child slaves. Different conversation, right? But I'm not against the idea of private consumer goods. But when it comes to public things like education and healthcare, those should be public, because it turns out those are public social goods. There's having a robust healthcare system and a robust education system that is for the public. Turns out that's a societal good. Okay, it turns out that's necessary, and it works better when it is properly funded, and when you don't have all this privatization that happens. Okay, and so unfortunately, though, what you're going to continue to see from these DOGE dipshits, okay, is a call to cut things that actually help people. Elon Musk wants to cut $2 trillion from the budget. Good luck with that. Okay. And of course, what they're targeting is completely the wrong things. You could cut some money from the Defense Department. Okay. Progressives are like, hey, Elon, cut the Defense Department just a little bit. There's no reason they need to have over $800 billion, especially when they failed their 7th straight audit. You could do something about that. Odds are, though, that most of what they're going to look at is their pipe dream of undoing these New Deal programs, Medicare and Social Security, and placing that public money into private hands. Because at the end of the day, this is not about cutting costs for the government. It's not about taking on the national debt, which the national debt, by the way, is a result of cutting corporate taxes and taxes on the rich so much while continuing to do massive amounts of military adventurism in the Middle East. Okay, George W. Bush took a surplus, turned it into a massive deficit, and we have never recovered. Donald Trump, with his first tax cuts for the rich, actually made that much, much worse. And unfortunately, he's going to make it even worse with his new round of tax cuts for the rich. So again, if you wanted to actually cut costs, there are ways to do it without compromising these very effective anti-poverty programs, but they're not going to do it because it's not about cutting costs. It's about moving public money into private hands.